So good morning. If I count the research gaps in the country in tobacco control, so if I have to prioritize, so there are 5 gaps. So one gap in tobacco control is the contextual research. So contextual research is missing in many areas, specifically on the priority areas of taxation, on priority area of tobacco endgame, or framework convention on tobacco control strategies. So these are some of the research gaps, the one gap which I think about in tobacco control. The second gap in tobacco control is implementation gap. Like we have policies across, we have a strong national tobacco control program, but we fail to implement it effectively. So that is the second gap in tobacco control which I think about. The third gap in tobacco control is people are not aware about the importance of tobacco control vis-a-vis other health programs. So people think tobacco control is a very small area, but let me tell you that tobacco kills half of its users. So it's not a very small area. So tobacco kills more people than combined deaths of tuberculosis, malaria and AIDS. So that's the third thing which we should, which the gap is. The fourth gap is about the advocacy to various organizations, to various people, to policymakers, to non-governmental organizations. So that is the fourth gap which I think, and we need to fulfill that. We need to unite everyone to work towards. And the fifth gap is community mobilization. So people are aware about the harmful effect of tobacco use, but they think it is normal. Tobacco control, people, if somebody is taking tobacco, they think it is normal, but we need to denormalize it. So community mobilization is very important, and there we need to work more about it. So these are the gap in tobacco control. If I have to say about the gaps in research in tobacco control, so again, I will say 5 gaps. Number one, if we talk about the strategies of WHO, that is Empower. So among Empower, R is the strategy which is very effective, that is raise of tax. We don't have a sound research which will tell about, we have fuse research, but we need very sound research on tobacco taxation. The second thing, now people have done, government has done exemplary work in tobacco control in last 20 years. Now we are in that phase that we need to move beyond tobacco control, that is tobacco endgame. So we need to do more research on tobacco endgame now, which is in fact missing in our country. And the third research, if I have to say, is multi-sectoral coordination. How we can maintain that multi-sectoral coordination between researchers, academicians. So we need to build some models. We need to build some models to show that if we have to work, if we work together, we can gain. So these are some of the research which I think are very important. Now, what PGI is doing in tobacco control is there are multiple things which we have been doing. We have built a resource center for tobacco control way back in 2016, which was inaugurated by then Health Secretary, Government of India, Madam Preeti Sudan. And thereafter, the resource center has done a lot of things, including holding the last conference of National Tobacco Conference on Tobacco Health, which this time is being organized by IIHMR. 6th one, we organized the 5th conference, and we had 100 plus consultations, webinars, and at the national level, international level, and at the sub-national level. And also, we have a network of 250 plus experts which work on various diverse issues on bridging those gaps. And also, the Resource Center for Tobacco Control compile all the resources for our young researchers, young academicians, so that they can make use of it. And also for implementers, we have a pool of 1500 circulars and orders which they can use in development of policy. So, and recently our Resource Center for Tobacco Control has opened a tobacco endgame hub, because now it is a need of the country to work towards tobacco endgame, and we have resources there, and we encourage our researchers, young researchers, academicians to collaborate with Resource Center for Tobacco Control at PGI and work towards tobacco free India. That's all. Thank you.